So we end up with this. This is what happens when you take the acute care model and you apply it to chronic disease. Patient comes in and says, I have arthritis. Oh, I'm going to give you an NSAID. Or I have irritable bowel syndrome. Oh, I'm going to give you something for that. I have high blood pressure. I'll give you an ACE inhibitor. Migraine headache. I'll give you a triptan. Every ill has a pill, right? And then, of course, all these pills give you heartburn, so you get an H2 blocker, and then you're depressed over the whole thing, so we have an SSRI. And I invite you to think about this way of thinking, because this is how we were trained. Name it, blame it, give a drug to tame it. More importantly, we get paid for this. We get paid for diagnoses. We don't get paid for outcome. We are incentivized to do this diagnosis game, do things to our patient, record it, and get reimbursed. And I can tell you, when I left the cath lab and 750 stents a year and decided to practice preventive, integrative, holistic cardiology, you can just imagine what happened to my salary, right? We don't get incentivized for keeping people well. So when we start thinking about the origins of illness or disease, as we say, we have to think about everything, someone's environment, whether they're exposed to toxins, whether they've had trauma, emotional trauma, physical trauma, what kind of nutrients are in their body, what kind of alcohol and drugs they're using. How do they respond to a stressful situation? Are they physically active? All of these things turn our genes on or turn our genes off that make us healthy or make us sick. You can't fix this with one pill, right? You need to look at the whole person. That's what integrative holistic medicine is about. It's not substituting Lipitor or red yeast rice for Lipitor. It's not that. It's about who is this person that I'm in this space with? What's going on in their life? Let me look at all of these issues and let me put a plan into place that's going to make a difference. As a holistic physician, I believe that everything that happens to a patient can be an opportunity. It's an opportunity for spiritual and emotional growth. And my goal is to promote the patient's own spirituality rather than imposing my own.